Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPAcares. Now here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm your host, Kyle Longton, and with me is our co-host,
Maddie Norton. Hi, everyone.
Maddie, it's been an intense couple weeks, or a few weeks, I guess I should say, since our last podcast. And I encourage people to go back. That was our overview of open season. You grilled me and got the details out for folks.
I did.
And you've been, I think you and your colleagues on our outreach and communications team have been hitting the road.
We have locally in the DMV area.
Yep, meeting with federal agencies, hitting the health fairs, answering questions, maybe recruiting some new members, I hope.
Hopefully.
We'll see. We're watching the numbers. And then some of our colleagues and I have been on the road internationally.
Yes.
To talk to members around the world and get a sense of things for them. So we'll talk about that a little bit later. But I just want to remind people that it is open season. That means your opportunity through, Maddie, do you remember when it ends?
December 11th.
Perfect. Okay, December 11th to make changes to your FEHB enrollment, your FedVIP, that's a dental and vision on the federal program, and your FSA Feds. And that FSA Feds for active employees only, but you've got to take action on it every single year. Maddie, what else do we have going on in the next week? Because this episode should be reaching people on December 4th. We have 1 week left in open season. We've got a few things left for folks to engage.
Yeah, even though it's only 1 week left, we still have a jam-packed week. Kyle will still be doing webinars almost daily for you guys at different times of the day as well. So, if you're overseas, don't worry, Kyle will be there at 10 p.m. Eastern, sometimes 5 a.m. We recently just did AFSPA Live, so you can find that recording at our YouTube page, AFSPA Cares. That was all about PDP, the new Medicare Part D plan. So you can learn all about that. And of course, on our open season webpage, you can find all of our new brochures, all of our updated benefits and the new benefits. And we also have a blog out with the new benefits for open season, especially with some webinar dates as well, and all the places you can find us for our podcast, for the YouTube, all up to you. And if you want to register for any of those events, you can go to afspa.org/events.
Excellent. And I think there's also a couple things left with the virtual benefits fair.
Oh, you're correct. I can't believe I forgot that. No, and on December 7th, I believe, we have our last day of the virtual benefits fair, and we have some great team members helping to answer any questions you may have. You do have to register for that separately, but you can find all the information you need on the events page on our website. If you have any questions, they will be there to answer from 10 a.m. to 5 p.m. December 7th. And they know so many things. So if you think your question's a little too specific, don't worry, someone knows the answer. So definitely check that out and make sure that you know all of the things that are happening this open season and all the new benefits.
Excellent. And we have assembled a team of experts today to walk us through some of those questions that people may be asking during our webinars, during that virtual benefits fair, even during our travels around the DMV and around the world. And Maddie, I am very excited to have this group. I haven't seen some of them. Some of them probably have seen too much of me from our travels together, and others I haven't seen in a long time. Or we met serendipitously on an airplane coming back from Asia, things like that. But I am delighted to have them with me to help us navigate some of these frequently asked questions and topics that we've been hearing. So, and Maddie, you as well helped a lot with the AFSPA Live we had on November 30th. But I want to dig into broader open season topics with help from our colleagues. And I'm going to introduce them and ask them each just say hello so you can recognize their voices we're going through. And I'll start with our Senior Director of Compliance, Stefan Nicely.
Hello, everyone.
And followed by our Senior Director of Operations, Twanisha Johnson.
Hi, everyone.
Senior Director of Ancillary Insurance Programs, Adrian Seabrooks, is with us as well.
Hello, everybody.
Igor Cherebko, our manager of our research section in health operations, is here.
Hello, everyone.
And his travel partner from their 2-week drive across Germany, Andre Walker, our compliance supervisor, is with us as well.
Hello, everyone.
And finally, the person who may be tired of seeing me because we spent 2 weeks together in Asia, Natalia Montoya, our compliance coordinator.
Hello, everybody.
All right, so let's go ahead and get started on just tackling some of these questions. Now, all of us have recently returned to travel. I'm glad to be home, although I feel like I always come back with a cold or something. I think some of us may be going through that as well. But with all of our events overseas across 7 countries, I think we had the opportunity to speak with well over 100, probably close to 200 members in embassies and consulates and on military bases. And, you know, I value these trips. They can be tiring, but I value these trips because it's an opportunity for us to talk to our members, understand their needs, and how best we can go about meeting their needs. We've also had a number of webinars. Igor, I think you've been helping answer the questions for the virtual benefits fair and more. So we've got a lot of takeaways, a lot of questions to answer from these events. So I want to start with some of the big questions we've had around changes for 2024. And so I'm going to turn to Stefan first, because it is her team that helps us manage the benefit changes and get everything through, working with Aetna and Express Script and importantly with OPM. So Stefan, let's start with infertility coverage, because this is a big change this year. What will our coverage be in 2024?
So first of all, we have expanded the coverage. We have removed the $5,000 annual limit that we had in 2023. We will be offering coverage for the medical and prescription drug sides of artificial insemination and in vitro fertilization and similar services. And then lastly, prescription drug cost for these services will be covered under the prescription benefit in 2024.
Excellent. So some good changes there. We're also partnering with Express Scripts and their, I believe it's the Freedom Fertility Pharmacy that offers some specific support programs as well for those prescription needs. And I'm so excited about that and the expansion of the benefits. And you know, Dre, you're also were key in getting the benefits changes, particularly this one. We went back and forth for nights and weekends and months, and you and your team did a lot of work on this. So are there, just so that members are clear, are there specific requirements that must be met before a member can access infertility benefits?
Yes, members must get prior approval from the plan before accessing the benefits. And for members receiving care in the U.S., they must go to an Institute of Excellent Infertility provider for coverage.
And Dre, I just want to go back to the prior approval piece, because we've had some questions about this year, and members overseas don't typically have to seek prior approval on most services. Do they need it with infertility services?
Yes, they do.
Okay. So that is one of those where members need to get it wherever you are. You need to make that call ahead of time, and we'll make sure that the phone number for that for the prior approval line is in the show notes, because it also connects you with care managers from a national team of excellence where all they do is infertility cases. So they're really well equipped to help you. But it's not just the care management support that we're offering. And so Twanisha, I want to turn to you and stay on the topic of infertility. There's some other programs that we'll be offering both now, but particularly in 2024, to support people who are on their family formation journey. Can you talk a little bit more about some of those?
Absolutely, Kyle. And you're right. This is definitely something that came up quite a bit while on travel. We will continue to offer fertility advocates through our partners at Aetna. More information on that in the show notes as well. We have a new partnership launching in 2024 with Maven Clinic. And this online clinic operates around the world and offers support to women and families for the family formation needs, maternity, early parenthood, childhood, and continue care through life, including support during menopause, which is great. And it's really a great program that is free to members around the world.
That's right. I think it is a fantastic program and really meets the needs of our members around the world. And we are working on an upcoming podcast episode with a deeper dive into the services offered by Maven. Okay, let's move on from infertility and talk about one of the questions that has dominated a lot of our webinars, as well as the most recent AFSPA Live, and that is prescription drugs, particularly the prescription drug plan that we're offering starting next year. So Igor, you have long been the go-to person for me and I think pretty much everybody in the office when it comes to the utilization of prescription benefits and how we can work on that. Can you provide a brief summary of the FSBP, Express Scripts, Medicare prescription drug plan, or more easily, the PDP?
Yes, Kyle. Yes, PDP, this is a new option that only affects the prescription benefits, those in Section 5F of our web brochure. Foreign Service Benefit Plan is auto-enrolling members aged over 65 who live in the US and are enrolled in Medicare Part A and or Medicare Part B. The prescription drug plan offers lower out-of-pocket costs for prescription drugs and a wider network of pharmacies in the network from which you can obtain 90-day supplies and specialty medications. There is no additional premium for this plan, but some members' income may require them to pay an income-related monthly adjustment amount, so-called IRMA, ranging from $12.90 per person per month to $81 per person per month. And this is the main reason why some of our higher income members are choosing to opt out.
Excellent. And I want to say one more thing about this because I got a lot of questions with the AFSPA Live recently. And that is that this is a wraparound plan. So anything that's covered under FSBP, any drug will continue to be covered under the PDP, even if it's not a Medicare approved drug. We're providing wraparound coverage so members will still continue to have access to the drug. And we talked about painstaking discussions with OPM on infertility. Those same discussions parallel have been happening with the PDP for months to make sure on our part, as well as OPM's verifying that we're doing it, that this is a great plan for our members. It offers robust coverage equal to or with the lower out-of-pocket costs and wider network of pharmacies, better than the high option benefit. So there's a lot more that can be said about the PDP. There's a lot more that has been said. And I encourage you all, if you're interested, go back, listen to the podcast episode from October 23rd. Go back and watch on, as Maddie mentioned at the top, our recording of the November 30th AFSPA Live. There's tons of great questions in there. We had someone from Express Scripts to answer them. And it ranged, the questions ranged all over the place, answering all manner of questions, even some very specific. So check that out.
And if you have any further questions, don't forget to check out the AFSPA.org/PDP page. You can find out how much your prescriptions will cost if you do join this plan, and that's where you can also opt out. So please be sure, if you have any further questions, also check out that page. We have so many links and resources for you there.
Great point. Yes, definitely. You can find the link to the network of pharmacies as well as the pricing tool for the dedicated to the PDP. All right, now our overseas travels, as I said, took us around the world in teams with some help from our friends at Aetna this year as well. Now, Natalia, we got questions in some of the webinars and during those travels about our direct billing partnerships, these direct billing arrangements, the DBAs that we offer. This is your area of expertise. Can you give members a brief overview of how the direct billing partnerships work, how many we have, et cetera, just they understand, because we had a lot of questions about the basics.
Okay, yes. AFSPA has agreements with more than 100 providers covering over 200 locations around the world. These agreements include major hospitals, clinics, and even individual providers. We offer these arrangements as a convenience to members. You go to one of our providers, show your ID, your FSBP ID card, and the provider bill us directly for service covered by our agreement. This saves members from having to pay large amounts of out of pocket. Our members can find a list of partners on our website, afspa.org/FSBP. Just look for the overseas partners page. By using the Find an FSBP Overseas Partners tool, members can search by continent, country, and city.
Absolutely. That the filter tool, the search tool there is very helpful.
Yes.
And we don't have partnerships everywhere. We have them where we've got a lot of members and where we've had some support in getting the agreements in place. And so we're always expanding that. That is Natalia's job. That is what she's been working on for years now, making sure that those are in place. So I encourage members to check that out, utilize those where possible. It's a convenience for you. All right. Let's get out of the health realm a little bit. And Adrian, so I'm turning to you. You know all about the health program and FSBP, but you also are our expert on all the other programs that we offer. And so I don't mean to put you in that corner, but I'm going to because I need your expertise here. I was delighted that in a recent webinar, we had somebody out of the blue start asking about AFSPA's programs on dental. And then another person started asking about life and disability. And I was happy to tell them, yes, we do offer these plans. But we had to go through several steps of clarification. So I'm hoping you can help with that clarification for a wider group of members.
Cool.
Do we offer dental insurance, and is that through the FEDVIP program?
Yes, Kyle, we do offer several dental programs, and 3 of them are domestic. Dental Dominion National EPPO, Cigna HMO, and Cigna PPO. But we also offer a Cigna International plan that works very similar to the Foreign Service Benefit Plan and really is beneficial for dental services overseas, rendered overseas. These plans are separate from the FEDVIP plans. They do not adhere to the federal open season. You can enroll at any time. And we will cover dependents up to age 26.
That is, first of all, that added flexibility can be a real help to members. The FEDVIP, fewer qualifying life events than in the health program. So keep that in mind. And then also, yeah, the coverage under FEDVIP does end. Well, it changes a little bit depending on how you're enrolled and what age, and our kids.
Exactly.
Students
Yes,
and so
I believe they cover dependents up to age 23, but you have to be a full-time student.
Well, and it's 23 if you're enrolling as a uniform service retiree. It's
Yes.
22 for civilians, and it's
Yes.
21 if the child
Exactly.
it's a flow chart. A must be B to yeah. So there's great information on benefeds.com about that. But our plans are straightforward, so check those out as well.
And you can on our website. If you go to www.afspa.org/dental, or you can call us to get and our insurance specialist will be happy to review them with you.
And we'll put that link in the show notes as well as our main office line as well. And Adrian, you can apply online as well, right?
Yes, you can.
Okay. All right. Now,
anytime.
Excellent. And what about life and disability? I realize those are different plans, but both of those coverage types came up in a recent webinar. Can you talk a little bit about what we offer in each area?
Sure. We do currently offer a term life plan, group enhanced life or GEL, and an accidental death and dismemberment plan. We call that AD&D. And you're eligible to enroll up to $600,000 for each plan. And I just want to remind members that for AD&D coverage, there's no underwriting. So as soon as we receive that enrollment form, you're enrolled in the plan. We also offer 2 disability plans. They're underwritten by Cigna. They offer some great financial protection in the event that you're unable to work for an extended period of time due to a covered illness or injury.
Excellent. And like you said, that isn't there's not a separate disability plan offered by the federal government right now. And the plans we have can also offer protection for members who are higher income. We've got some protections in place for them as well to better meet their income.
Yes.
All right. Well, I think that covers the broad spectrum of questions we've gotten during the various events and travels around the globe. I'll just put it out there. Anybody, is there anything you think we missed or that we should add? Don't all speak at once. I'm going to take that as a no, and say thank you again to Stefan Nicely, Twanisha Johnson, Adrian Seabrooks, Igor Cherebko, Andre Walker, and Natalia Montoya, as well as my great appreciation for Maddie Norton. Thank you all very much for making this episode happen. Hopefully our members find it useful and informative. And we'll be back pretty soon with another episode of diving into some of the benefits and programs we offer at AFSPA. Thanks again to my colleagues for joining us for today's episode. I am helped every day by their expertise and just having this great team, as well as so many others who work for AFSPA. We're at about 100 employees now, means that we can better serve our members every day. So thank you to them. For more information about open season, I encourage you to visit afspa.org/open season. Also check out the show notes for additional details on the changes and programs that we discussed today. And please don't forget to follow us or like us on your favorite podcast app. Subscribe so that you don't miss a future episode of AFSPA Talks. Please rate and review us also where that option exists, and share feedback with us on Facebook, Instagram, and LinkedIn. Look for AFSPA Cares. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information covered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. We'll talk again soon.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPACares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.